topic is multicystic kidney dysplasia. Have you ever wondered what would happen to your body if just one tiny organ did not function properly? During this speech, I am going to inform you about multicystic kidney dysplasia. Hyman's 1998 stated that 1 in 3,000 live births result in the diagnosis of multicystic kidney dysplasia. I have done some research about multicystic kidney dysplasia. Multicystic kidney dysplasia hits home for me. My daughter was diagnosed while I was just 5 months pregnant. I have experienced firsthand multicystic kidney dysplasia. I have become educated about further effects and all that it entails. I have also gathered information about MCKD from sites regarding basic definitions, symptoms, treatment, and function of the working kidney. Today I will share my personal knowledge of multicystic kidney dysplasia along with information gathered regarding multicystic kidney dysplasia presented by medical professionals. I will begin by giving some basic definitions, symptoms, and diagnosis of multicystic kidney dysplasia. Multicystic kidney dysplasia is often referred to as MCKD and is a consequence of embryological renal maldevelopment, which results in a non-functioning cluster of non-communicating cysts surrounding fibrous tissue, according to Hyman's 1998. Diagnosis is most often prenatally via ultrasound. I discovered my daughter had MCKD while I was pregnant during an ultrasound. The kidney often appears one larger than the other and contains cysts. In a study conducted in Turkey, 20 children were evaluated. The study shows that more than not, the left side is more affected than the right. Postnatal ultrasounds will confirm diagnosis and screens for other urinary tract abnormalities. This ultrasound is performed after the first 48 hours of life, according to Haynes 2008. Often those diagnosed with MCKD are also diagnosed with other complications within the urinary tract. According to Haynes 2008, many concurrent urinary tract abnormalities have been described in patients with MCKD. Most common is reflux to the contralateral kidney. This allows urine to back up into the kidneys and cause serious complications. Patients have also been known to suffer genital abnormalities, most often in girls. Occasionally, girls diagnosed cannot have children in adulthood. So what happens when someone is diagnosed with MCKD? How do doctors treat such a condition? Treatment options have changed over the years as medicine as a whole has evolved. So does the treatment of the condition such as MCKD. In previous years, urologists believed that removal of the non-functioning kidney was best. Nephrectomy was performed once all testing and diagnosis was complete. Testing of the urine, serum levels, and blood pressure are a few tests required. Most often the cause of nephrectomy is hypertension in those suffering from MCKD. Blood pressure is monitored at all follow-up appointments. Medication is often prescribed to try and decrease the high blood pressure. In more recent years, studies have been done concerning the need for immediate removal of the affected kidney. Doctors in present day believe this is a more radical approach. Follow-ups vary according to the diagnosis, and sometimes no further follow-up is necessary. These appointments are made according to the condition and any other complications that may be present. Ultrasounds are performed at 3 to 6 months intervals for the first year of life, according to Haynes 2008. The next course of treatment includes those diagnosed with other urinary tract abnormalities. Those follow-up checkups include blood pressure fluctuations, abdominal masses, and urine screening. Doctors monitor these conditions with the hopes that the affected kidney will involute. Sustaining life requires lifelong monitoring and care. Life with MCKD can be completely normal. People diagnosed often go on to live normal and productive lives. The kidneys are responsible for helping the body maintain homeostasis. The kidney filters blood, regulates acid-base balance, extracellular fluid level, and regulates the body's blood pressure. The kidneys are full of nephrons that act as tiny filters. These little filters are not functioning properly, the body begins to shut down. Those affected with MCKD often have problems with hypertension and infections of the urinary tract. Blood pressure monitoring is necessary. Drinking is often avoided as its effects are great on the kidney. The condition is lifelong and will require monitoring for life. Adjustments are often necessary throughout life, including changes in diet and the addition of blood pressure medication. In conclusion, I would like to close with the following statements. We explored the basic definitions of the condition, symptoms, as well as treatment options. We also talked about the role the kidneys play in the body and what life is like after diagnosis. I hope that this information is helpful in understanding what exactly MCKD is and how the body adjusts to life with only one functioning kidney would be like. I am hoping that everyone has a better understanding of how important 2 working kidneys are to the body. Your body is amazing. Treat it as such. Not everyone is lucky enough to have a perfectly working body, and those who do should feel blessed.